Indications for egg freezing are multiple. First, let's talk about the medical indications. The obvious first indication would be someone who's been diagnosed with cancer, who can be treated with chemotherapy or radiation therapy. The cancers such as breast cancer, the medications that are used for the chemotherapy are very toxic to the ovaries. And most women who use treatment for undergo chemotherapy for breast cancer treatment typically will go into an early menopause. So anyone diagnosed with cancer and they're going to receive chemotherapy, radiation therapy should consider freezing their eggs. There are genetic links or disorders called Fragile X. Some women carry a Fragile X premutation, and if you do carry the Fragile X premutation, it's been shown that you'll have an earlier menopause. So this is an indication for egg freezing. A medical condition such as endometriosis, which requires multiple surgeries on the ovaries, and may also lead to an earlier menopause due to the decrease in blood supply that happens with these surgeries, as well as the type always having the surgery on the ovaries. This also leads to premature ovarian failure and is an indication for egg freezing. Other things that are important to consider when you're thinking about egg freezing are transitioning couples or a transitioning person who's decided they would like to transition from male to female. And it's important for them to consider sperm freezing, or if you're transitioning from female to male, you want to consider these egg freezing prior to undergoing your transitioning process because, or the surgical process, because of this can also lead to sterility or loss of eggs. And then the final indication for egg freezing is just someone who decides they want to preserve their fertility for the future. And it's what we call social egg freezing. Is it too late to ever consider freezing your eggs, or is it too early? The answer is no. There's the ideal time to consider freezing your eggs, and that would be, of course, for medical prior to medical treatment at any age. But for someone's undergoing social freezing, you should consider freezing eggs in your early 30s. Uh, However, you can freeze eggs in your 20s, you can freeze eggs in your late 30s, early 40s, but we have to remember that the age and the quality of the egg that goes into the freezer is what's going to come out in the future. So if someone's in their early 40s and they're considering freezing their eggs, you can definitely freeze your eggs, but the success rates may be very low because of the age and the quality of the eggs were frozen. I've had patients who are 45 years of age. I've actually had a young lady who's on my schedule to be seen for this week who's 50, and she wants to consider freezing her eggs. So in those cases, we discuss the process, discuss the pros and cons, and let the woman or the patient herself decide what she would like to do as long as she understands the risk or benefits.